for all of you to join me once again in this, what is now the sixth installment of the parent training caregiver collaboration that we have been working on. My name is Mihala Schwartz, and I will guide you through month 6 of our parent training. Let's review a little bit the first 5 months that we had together, because a lot of the concepts that we have talked about and that were introduced, you're going to see a lot of that verbiage and a lot of those concepts reappear in this segment when we're talking about managing challenging behaviors. Basically, for the first 5 months, what we looked at was foundational ABA concept. We looked at what ABA is specifically and how behavior works. We looked at ABCs of behavior, and we talked about antecedents, behavior, and consequences. We talked about the importance of routines, motivation, how to create motivation, reinforcement, what is it, how do we do it, and then teaching through those daily moments that appear in all of our lives when we're around our children. Understanding behavior functions, teaching communication, prompts, generalization of concepts, all of these things that we went through over the last 5 months that are going to be important as we move now into month 6, talking about how to manage challenging behaviors. The big idea that we have covered in all of these little snippets through these last 5 months is that ABA builds skill step by step through intentional, consistent teaching. So, as I mentioned, what we're going to look at today is how do we manage challenging behaviors? This is one of the most challenging things that parents face when you're talking about children on the spectrum, especially those children that really, really struggle with some serious challenging behaviors. So we're going to look specifically at that during this month's training. The presentation goals that I set out as we embark on this journey is understanding why behaviors happen, and then learning how to respond effectively, and actually talk about specific strategies that can be used to learn to deal with these behaviors. And then how do we support positive behaviors at home? Because the more we have these positive behaviors in place, we're going to see the less problematic behaviors. They work in inverse of each other. So think about a child not being able to communicate wants and needs, becomes frustrated. You're going to see problem behaviors. But as they learn to ask for things, you will see more asking, which is an acceptable behavior, and less problem behaviors. And we're going to talk about that a little more, but that's basically the overall concept. Challenging behaviors, when you think about them, are communication. And we talked about this last month as well. Challenging behaviors are a way that someone communicates something. And we can change the way they are choosing to communicate whatever it is with consistent strategies. If I know that I'm going to get the reaction that I need by banging my head against the wall, and that is my way of communicating that I need something, or I need attention, I need access to the iPad, I need something, banging the head in the wall has worked every time, then that's what I'm going to continue doing until someone teaches me a new method of getting that same exact result in an easier way. We'll talk about that more. But you want to be able to have an alternate behavior that requires less effort than the other bad behavior, right? But the effect is going to be the same. As humans, we're always going to take the easier way. What is challenging behavior? Can be anything. Tantrums, screaming, aggression, refusal, or non-compliance. No, I'm not doing it. Property destruction, throwing things, elopement, running away. And it could be real serious things like self-injurious behavior, although I didn't cover too much of that because that's a conversation by itself. But just being aware of self-injurious behavior can be a challenging behavior to deal with, depending on what's causing it. When do these behaviors occur? As most parents will be able to tell you exactly when they see these types of behaviors. When the child wants something and either was told no or it's not able to get it right now. When the child wants to escape something, it's time to take a bath and the child doesn't want to take a bath. It's time to do the homework and the child doesn't want to do the homework. When the child needs attention, you're tied up with talking to someone, and that's when the kid is just going to start screaming because they want attention from you right then, that moment, and they don't know how to wait. Or when the child is overwhelmed. I used to work with a kiddo in the school setting, and anytime we were in math class and they would present a worksheet, he would just absolutely start engaging in horrible, challenging behaviors, screaming, tantruming, throwing himself on the floor, kicking, screaming, ripping paper, throwing things, because he knew that the teacher would have no option but to send him to the front office. And come to find out after working with him for a few weeks is that he genuinely was embarrassed that he had no idea how to do any of the work on the worksheet. And rather than being able to say, I don't know how to do this, I need help having this task broken down for me, he found a way to get himself out of that classroom and avoid the whole thing. So these are just some examples of when we see challenging behaviors develop in a child. Again, behavior is communication. Anytime somebody engages in a behavior, they are communicating something through that behavior. What does that mean? That means if they cannot communicate it through words, if that means they're feeling frustrated, that means they're trying to avoid a task, or they want access to a preferred item. One of the things that you may remember we talked about, and we'll talk again a little bit later, are the 4 functions of behaviors, and this absolutely fits into that. So if I cannot communicate what I want, what I need, then I'm going to engage in a challenging behavior because I know it's going to get me the result I'm looking for. If I feel frustrated, I will do the same. If I don't want to do the worksheet, as in the example of the little boy I described, then I'm going to engage in behaviors that I know are going to get me out of it. I want the iPad and mom doesn't want to give me the iPad. I know that if I start screaming and screaming and stomping my feet and throwing things, mom's tired. She just worked all day. And the easiest thing for her is to just hand me that iPad. And that's what's going to happen. So I just need to keep at it until I get it. Instead of asking, how do I stop this behavior in the moment when it's happening, try to reframe it for yourself. Other than become frustrated or upset and wondering, how do I stop it? Ask yourself, what is this kid trying to tell me? Because if you could figure that out, then your reaction to that behavior may be a lot more positive. It may help you calm down, and you may get to resolve the situation before it continues to escalate. So reframe it for yourself. One of the things we've done in the field is, we stopped using words like maladaptive behaviors. We stopped using words like attention seeking, and rather we're now looking at connection seeking. When somebody's screaming because they want your attention, what they're really seeking is a connection with you rather than just attention. So if you reframe it for yourself, you'll be looking at the function, trying to figure out the function, and therefore find an easier way to come up with a solution for it, because now you know why. Understanding the reason behind the behavior will help us respond effectively. Think of the example I gave about the kiddo in school that was just throwing this massive tantrum to try to get away from the worksheet. It was definitely not attention seeking. He didn't care about getting attention. What he really cared about was avoiding the task. So being able to figure out that the function was avoidance of the task, and then figuring out that the reason he wanted to avoid the task is because he simply didn't know how to do it. He didn't have the foundational math concepts that would have allowed him to be able to do it, and he was embarrassed, so he just wanted to be done with it. So now you can see where understanding why it's happening can help you find the proper reaction to the challenging behavior. Let's look at the ABCs of behavior. For some of you, this may be a review. For others that are just now joining us for the first time, welcome. So we're going to review them real quick. In ABA, we always look at the ABCs of behavior. And what we're specifically looking for is antecedent, behavior, consequence. Antecedent meaning what happened right before the behavior occurred. What happened? Behavior. Specifically, I always ask the RBTs or the techs to tell me, what did the behavior look like specifically? What did the child do? And then what was the consequence? What happened right after this happened, right? So if you look at the kiddo that I'm using as an example, the antecedent was the worksheet, the math worksheet in front of him. The behavior was screaming, throwing himself on the floor, ripping paper, stomping his feet, screaming, all of that. And what was the consequence? The consequence is he got sent to the front office and avoided the worksheet altogether. So that would be an example of what the ABCs were in that particular situation. Antecedent, the example in the slide, homework is given. Behavior, child throws the pencil. Consequence, homework is removed. Odds are that when you're looking at those ABCs, and you'll have to, this is something that we're going to have to look at again the next time, that the child is given homework. But the odds are that in this particular case, it was avoidance, right? That was the function of the behavior. I don't want to do it. Now there's a lot of questions with why doesn't he want to do it, right? But at least we have a starting point. The child may not want to do it because he doesn't know how and is embarrassed to ask or doesn't know how to ask. The child may be feeling sick and just not feeling like doing it right then and there. The child may have imagined something else was going to happen later in the day, and now he's being handed this homework. So there's a lot of reasons why, but at least we've got a starting point of knowing that it was avoidance that was the function of that behavior. Sometimes the consequences that happen will reinforce the behavior. So if you're thinking about my kiddo that didn't know how to do the math worksheet and would throw these massive, massive tantrums whenever they would put a worksheet in front of him, what he learned inadvertently was that every time he behaved that way, he didn't have to do it. He just went to the front office and sat there by himself. And he enjoyed getting away, avoiding the homework, and just sitting at the front office. So for him, it became very reinforcing to keep this behavior going every single time a worksheet was presented. Common functions of behavior, again, there's only 4, and that's it. Almost every human behavior fits into one of these 4 categories in the moment, right? Either we're trying to get attention, we're trying to get away from something, we're trying to get access to something, or it's like an itch and you have to scratch it. It's a sensory automatic reinforcer. These functions are really, really important because you would respond very, very differently to, let's say, an elopement, a running away situation, depending on what the function is. So let's say you give a child homework and they take off running, and as they're taking off running, they look behind their shoulder and they're giggling and they're laughing, and you're chasing them and trying to catch them and getting frustrated, and they're still doing the laughing and, oh, you can't get me. That most likely function of that running away is probably attention seeking. The response to an attention seeking or connection seeking behavior is going to be very different from just running away, not even looking at you, and just trying to get away from the homework, right? The trying to get away from the homework without giggling, without laughing, without looking over their shoulder, most likely is avoidance. So trying to figure out why they're trying to avoid this becomes important. Access to tangible, somebody, you put the worksheet and all they do is want to grab at your phone, pointing at their iPad. They want that tangible. And they're not wanting to do the homework because they want to play on the iPad. And then you have the sensory automatic reinforcement, which we can talk about a little bit later, but a sensory is more like an itch, and you've got to scratch it, or you need to do this for a little bit before you can start on your worksheet. So automatic is something that's self-reinforcing. You're not really looking for some outside reaction. It's just something that feels good and it's sensory for you. When we know the function, we can teach the appropriate replacement behavior. So let's use the child running from the homework. If it's attention seeking, then you know that we can put in place ways to give this child attention leading up to the time where he's being asked to do the homework. It's called non-contingent attention. So With a non-contingent intervention, for example, depending on the age of the child, you may put in place to where every 10 minutes, you're just going to play with the kid for a few minutes, and he's getting a lot of one-on-one attention. And so when the homework is presented, attention is not going to be a focus because they've been satiated on it leading up to it. If it's escape or avoidance, then it becomes important to figure out, okay, do you know how to do it? You want me to do one problem and you do one problem, let's do one together. And again, now you're breaking down the task, or you may even say, hey, I know there's 5 on this. If I do the first 2, will you do the last 3? Again, kids thinking, oh my gosh, I'm getting a heck of a deal because she's willing to do some. And now they're not as likely to want to avoid it because you've offered this deal for them. So again, once we figured out function, we can have the appropriate response for the function that they were trying to satisfy through the behavior. If it's access to tangibles, you could easily make a very quick deal, short-term contract or a pre-MAC principal situation where you say, how about you do the first 2 and then we take a break and you get 5 minutes on the iPad. These are easy ways to address based on the function of behavior for that particular scenario with the avoidance of the homework. I used to believe antecedent interventions or preventing challenging behaviors were the greatest invention ever, because why deal with a bad and a difficult behavior if there's a way to manipulate antecedents and help that child not be in crisis at all. There are pluses and minuses. While a child is learning alternate behaviors, while a child is learning to communicate wants and needs, while a child is learning how to do math that he doesn't know how to do, all these different scenarios, right? It is good to be able to manipulate antecedents and manipulate the situation so that challenging behaviors are prevented. That way the child can learn these alternate behaviors, these more positive behaviors. So we're in a win-win situation if possible. What are some prevention strategies? Clear routines. We talked about this a couple of months ago when we talked a lot about routines and how important they were. We talked about visual schedules. These are very helpful because it immediately transmits to the child what's going to come next and what's going to come next and what's going to come next, and it makes it a little bit easier to cope with it. Giving choices. Do you want to do your reading comprehension first, or do you want to do your math first? And give them a choice. They feel a little bit of control, like they have a say-so. Preparing for transitions. A lot of times we call that priming. It's something that we use often in ABA, especially when there's a timer. We'll say, hey, you only have 2 minutes left on your timer. And we teach the child to acknowledge that priming prompt so that when the 2 minutes is up, they're already prepared for it. They know it's coming and they'll be able to cope with it a lot easier. And then using first and then, that's a pre-MAC principle, basically saying, first you do this, and then you can have access to the iPad. A lot of times it's helpful to ask them what they want to work for if they're older children, and they will tell you, I would like to work for 5 minutes on the iPad, or maybe they want you to watch a Minecraft video with them on YouTube. But if you have a child that's able to verbally tell you what it is they want to work for, they become more of a stakeholder in that decision, and they're more likely to feel invested. First cleanup, then iPad is the example. That's an example of first, then this, or a pre-MAC principal situation. Very powerful. In my career, and I've had a long career with a lot of different children, I've only had one kiddo that had a really hard time with first this, then that. Because all he could hear that was going to happen, and he didn't want to hear about the first this. So we had to like readjust how we presented that. I also only ever had one kiddo who didn't like the, do you want to do this or do you want to do that, and didn't respond well. Most of the time, that's a very successful strategy. The one kiddo, he would hear the 2 choices and become so upset that he couldn't have both. So again, it was some readjustment involved with that. Many behaviors can be prevented before they even start. And it's really, really important to try to do that, especially as you set out to teach those alternate behaviors. You know, if I'm teaching a child how to ask for a break, or teaching a child to be able to tell me they just don't know how to do the homework, I'm going to use preventing methods, antecedent manipulations to keep the challenging behavior from occurring as I'm teaching those alternate behaviors that give them the power to express themselves. How do we teach replacement behaviors? In this example, break please, that's a huge skill. It's a huge skill, and it's a skill that many, many of our children don't have. Children just simply aren't necessarily taught that when they're feeling overwhelmed, when they're tired, when they're just having an off day, because they have off days just like we do, to just be able to look at you and say, could I first have a break, or can I have a break, please? That's a very important a skill. And that is one of the skills that we can teach that would keep a behavior from happening. Ask for help, request a break, use words or gestures, wait appropriately. I've had children who didn't have the voice, the ability to just look at you and say, I need help, or I need a break. So we had signs made up for them. For example, a laminated red sign that the kiddo would hold up instead of saying, I need a break. We taught him to hold up that, and he would automatically get a few minutes break before being asked to, before introducing whatever the demand was. Asking for help the same way, holding up a little sign that said help. Sometimes using a card like that is a little bit easier for some children than it is to actually verbalize what it is you're trying to teach them. Asking for help, requesting a break, using words or gestures, waiting appropriately, all of these are huge skills that are really, really going to help a child not engage in those challenging behaviors when they feel frustrated, or they feel tired, or they feel overwhelmed, or they just need some extra attention from you. Teaching a child to say, break, please, instead of throwing items. Think of how huge that is. I'm doing homework. I'm feeling overwhelmed. I'm tired. I've been in school all day, and now I've got to do this worksheet before I get to go play with my favorite toys. And I just really need a break. Think of how huge it is for that kid to be able to look at you and say, I just need a break, instead of gobbling up the homework and throwing in and screaming and throwing a tantrum. And that's what these alternate behaviors are. Replacement behaviors, this is important, is something I touched on a little earlier. It must be easier than the challenging behavior. If the replacement behavior does not lead to the same result that the challenging behavior would have led to, then it's no good, right? So when I say, can I have a break, please? I need to get a break just like I would have if I had thrown the biggest tantrum that just wore my mom out. Alternate behaviors have to be easier to do and have to lead to the same result. Sometimes these kiddos we work with are just so incredibly smart. And I had a kiddo that I worked with, and I think I mentioned him in months past, but he had no escalation in his challenging behaviors. Most of the time you have some escalation, right? Kid starts to whine, and then they start to cry, and then they get louder, and now it's a full-blown tantrum. This kid didn't. This kid went from 0 to banging his head into the wall, because he learned, I'm not going to go through all this escalation to get to the end result of what I want. I am just going to bang my head into this wall right off the bat, and I'm going to get exactly what it is that I want. So again, replacement behaviors, keep in mind, you want them to be easier to do, take less energy, but you want them to absolutely lead to the same result that the kid is looking for. Whether it's a break, whether it's for help, whether it's for attention, whatever that may be. Okay, this is all well and good, you say, but what do I do when the challenging behavior occurs, right? Because that's hard. When challenging behavior occurs, stay calm. More than anything, stay calm. Understand that even when you're not teaching, you're teaching. It's important for your child to see how you behave when you're stressed out, how you behave when you're tired, how you behave when you're frustrated, how you behave when you need a break. So staying calm is going to be extremely helpful. And I know that's hard. I've raised 4 children, and sometimes staying calm is really tough. Use minimal attention. Try to not make a huge deal of what's happening. Keep your child safe, obviously. Try to figure out the function of the behavior and respond appropriately. But don't try to over engage with the child and give so much more attention than they would otherwise get. Redirect to appropriate behavior. Hey, do you need a break? You need to ask me for a break? Do you need some help with that? Do you want to take 5 minutes? All of these things, redirecting to an appropriate behavior and reminding the child what is appropriate. A lot of times, I think back of working with the text, and you'll have a text say, was that appropriate asking? Or was that inappropriate? Was that appropriate asking, for example? And I always tell the tech, have you reviewed with the child what appropriate asking is? Are we sure that the child understands how to ask appropriately? So you can't expect this alternate appropriate behavior if it hasn't been taught or discussed. So it's always good to review those things when everybody's calm and say, hey, when we finish dinner, it's going to be time for you to do your homework. Do you remember? I want you to ask me for a break, ask me for help as you start moving through this homework, right? Reviewing that up front makes it very clear that the child remembers how it is that they're supposed to ask for what it is that they need. When the child uses the correct behavior, absolutely 100% reinforce it. Remember, reinforcement is reinforcing the behavior, means the behavior is going to happen more often. And that's what we want. We want these good behaviors to happen more often. So if a child appropriately asks for a break, please don't say, okay, just 5 more minutes and then I'll give you a break. Honor what they've asked for, because we've been working so hard on getting them to ask for that break. Honor it, and then move on with the next item of the homework or whatever it is that needs to be done. So honor their requests if they're done appropriately, and then you're reinforcing them being able to verbalize asking for a break, asking for help, asking for attention, whatever it is that may be. When a child is engaged in challenging behaviors, this is not the time to lecture them. This is not the time to talk to them about their inappropriate behavior at the moment, about none of that. That's just not the time to lecture. I know as parents, we're overwhelmed with the desire to lecture them when they do, but try to avoid that. Just redirect to the appropriate behavior and try to stay calm. The other thing is to not give in to the behavior, because you don't want them to get what it is they're looking for through the challenging behavior. I always use this example. I think back of my teenage daughters when they were teenagers, and I was tired, work all day, and I was super tired, and I'm sitting on the chair, and they would come in, can we go spend the night? And I'd be like, no. And they would just keep on, can we spend the night? Can you spend the night? And I finally would get so upset, and I'd be, you know what? Fine, you can just go ahead and spend the night. What did I just do? I just taught these girls that if they stay on me long enough and they make me angry enough and they just wear me down, they will get what it is they're looking for. I would have been better off telling them yes from the beginning than telling them no, 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 until finally I gave in, even though, I didn't make a deal with them. I could have done anything. I could have said, you know what? Yeah, you can, but let's first clean your room. Or, you know what? Not tonight, but can we do it tomorrow? I could have done any of those things up front, right? Alternate behaviors, good way of asking, good way of negotiating whatever we needed to. But instead, I got angry, and the more they kept at me, the angrier I became, and I gave into the behavior. And all they learned was, if you stay on mom long enough, she's going to go ahead and say yes. Consistency is key. And it's hard. I will be the first, having raised 4 kids, someone you can identify with this. It is hard being consistent because you're having an off day, you're tired, you didn't get enough sleep, you were struggling with things at work. But it's going to make your life easier in the long run if you can just hold it together, be consistent, stay calm, and follow some of these simple things that we're covering here today. So again, stay calm, minimal attention, remind them, redirect them to the appropriate behavior, and then reinforce when they use that correct behavior. Reinforcing positive behavior. This is very important. As soon as your child uses the appropriate behavior that we're really trying to increase, reinforcement increases good behavior. As soon as that child has engaged in a behavior that we want to see over and over again, praise immediately. But be specific in your praise, okay? Provide small rewards if needed, or if appropriate. Edibles like small Skittles, tiny little M&M, whatever it is that your child prefers. Those have been very, very successful for me in the home and clinic setting. But if you don't want to do small items that the child can eat as a reinforcement, you can provide other reinforcement. You can provide other rewards. You can say, you know what? You did such a great job asking me for help that let's just take a break and you just take 5 minutes on the iPad and then we'll move on from there. And they never know, which way the reward is going to come, but they know that if they appropriately ask for help, they're going to get a reward. Be very specific in how you verbally praise your child. Don't just say great job. Say great job for asking for help. Be specific about the item. That was great the way you asked me for a break. That was great the way you asked me for help. I'm so excited that you asked me for help. I love how you waited. I love how you waited for me to respond to you. All these very specific reinforcers will very specifically reinforce the behavior that we're looking to increase. Positive reinforcement increases good behavior. If it doesn't, if the good behavior doesn't increase, then whatever we're doing is not a reinforcer. And remember, the reinforcer, it's not decided by us. The reinforcer is decided by the child. We may think it's a great reinforcer to give the child a small M&M, but the kid may not like M&Ms and really looking for some more time on their game. So it's important to know your child and know what makes them tick and know what they appreciate as reinforcers, and keeping in mind that the reinforcer has to be appreciated by them, not necessarily us, and has to have value to them. De-escalating challenging behaviors. What do we do? Sometimes behaviors escalate very, very quickly, or you have a kiddo like the one that I described earlier that just goes from 0 to head into the wall because they've learned I'm not even going to fool with escalation. I'm just going straight to the highest possible volume, right? So stay calm and neutral. Again, that's hard. I know it's very hard to stay calm, stay neutral, no matter how frustrated or tired you're getting or upset. Reduce demands temporarily. It is always okay, as in the example I was giving with homework, to say, hey, how about you just do the first one and then I'll have a look at the second, we'll do the second one together, or I'll do the second one. Kind of like an IEP does, where you only have to do 80%. But it's okay to reduce the demand. It's okay to lower the expectation, right? I want to clean my room. I don't want to. I just cleaned it yesterday. And now you're making me clean it again. You know what? Just make your bed. Let's just make your bed. Kid feels like they're getting a deal. You're still getting a demand met, and it's a happy for everyone, right? Used to be when I first got into ABA, where we're like, once you place that demand, you got to stick with it. But that's not true, because now you're creating like a power struggle with the child, and that's not where you want to be. You don't want to be in a power struggle, right? So adjusting the demand, reducing the cost involved in doing what you've asked the child to do is okay. It's okay. So reduce the demand temporarily, give space. I'm going to give you 5 minutes, okay? Use a calm voice, redirect a coping strategy. Be careful about the coping strategies. My sister's a psychiatric nurse practitioner, and she worked in a mental facility for quite a while. And she said, if you really wanted to upset the patients, you would say, calm down. So be careful about using strategies that are more aggravating and making the situation worse rather than better. Your child more than anybody. Use strategies that would work for your kiddo. And if sending the kid to the room for 5 minutes, or letting the kid just sit there where they're sitting, I'm just going to give you 5 minutes. If that works for your kid, use that. But Redirect or coping strategy. After 5 minutes, I just want you to ask me for help if you need it, okay? Do you need a break? Are you asking me for a break? Okay, great, you've got it. Deep breathing, asking for a break, going to a quiet space. These are all examples of coping strategies. Again, they don't work for everyone, and they have to be specific to your child. Some kids get upset if you say, I just need you to take a breath. Some kids like, what? So you have to be careful about what coping strategies you're going to use them specifically to your kiddo. And on a day where you're just sitting around, if you've got a verbal child and an older child, it doesn't help to ask the child, hey, when you get really, really upset, what is really helpful to you? Like, what is really helpful in kind of like calming you down? They'll tell you, they'll be glad to talk about it. Children often borrow your emotional regulation, right? Like I was saying earlier, even when we're not teaching, we're teaching. Children are always watching us. They're always watching our reaction to things. So if you can stay calm, if you can stay positive, if you can stay neutral, they're going to learn from that and they're going to try to mimic that. Staying calm will help them calm down. The more upset and agitated you get, the more you scream, the more they're going to scream as well. Again, I know I'm asking you to do tough things. It's hard as a parent when you get upset, but these are the things that evidence shows are the most beneficial ways to get to where we need to get. It's important to be as consistent as possible across caregivers. Use the same expectation and rules, whether you're with mom or with dad, whether you're with grandma, whatever it may be. Use the same expectations and rules. Reinforce the same positive behavior. If your kiddo asks for a break and is able to get a 5-minute break before going on with what we call a less preferred task, then that should be honored at grandma's house as well. So I would have a conversation with grandma, say, hey, we're working really hard on teaching him to ask for a break. So please, if he asks for a break, please honor that and let him have 5 minutes. Respond to challenging behaviors consistently. If you have a method in place of what to do when tantruming begins, and maybe it's for the kiddo to just have a little space and make sure you don't get hurt, obviously, but have a little space, then that should be the same thing that happens at grandma's house. Important steps, again, use the same expectations and rules, reinforce the same positive behaviors, respond to those challenging behaviors consistently across caregivers, and communicate with your teachers and communicate with the therapists and communicate with everyone involved in that child's life. Here's what we're working on. We're really working on asking for help. And tell the teacher, hey, we're really working on kiddo asking for help in math class. He's really lost. He's really trying to catch up, but he will need help. And if he asks you for help, would you please help him? Or at least tell him that if he waits 5 minutes, you're going to be able to help him. This way, the child gets reinforced in those alternative behaviors that we've been talking about and not have to use the challenging behaviors to get the help that he needs or the break that he needs when he's frustrated or overwhelmed. If tantrums are ignored at therapy but rewarded at home, the behavior may continue. I will say that tantrums are no longer ignored at therapy, right? We used to do something called extinction. And we used to, like, if a child tantrumed, especially if it was attention-based, connection-seeking based, extinction was to just basically ignore the behavior. Now we don't do that any longer, and now we teach the alternate behavior instead. So if you're trying to get my attention and you feel like you're not getting it, we will teach the child how to ask for attention appropriately, how to ask for input from me appropriately, rather than just let them scream it out and do that planned ignoring like we used to do. It's a lot more effective to have an alternate behavior, right? So extinction has been replaced now with more of a alternate behavior teaching and non-contingent attention giving if that's what caused the behavior. Consistency across environment helps children learn faster. Your child will eventually learn to ask for help if that's in clinic, in therapy, in home therapy. And they will eventually be able to translate that somehow into the school environment. But it's a lot quicker and a lot more powerful if everybody can be on board from the very beginning, so that when the child has the courage to ask the teacher for help, they're going to go ahead and get that help. Common mistakes. Giving in after you say no. Remember my example with my daughters. Can we go spend the night? No. Can we go spend the night? And then finally just working on me and I'm tired. I'm like, you know what? Fine. Big mistake. Big mistake. And it took a lot of unteaching, right, to get over that. So don't, once you've said no, you can lower the demand, you can work out a deal, but try not to give in just entirely. And if you're gonna give in, and you know you're tired, you know you're not wanting to deal with it right now, do it on the very front end. Don't wait, right? So that day where I was so tired and I didn't want to deal with the, can we spend the night? Can we spend the night? If I had just said yes from the beginning, it would have been so much better than waiting for them to just work on me for however long it was. It seemed like a really long time, because all they learned was, if you just stay at it, she'll eventually say yes. Provide lots of attention. Don't provide a lot of attention during the problem behavior, right? Don't overblow the situation by adding even more attention to what's happening. Be careful about consistency. Don't be inconsistent with rules. If the rule is that you do this before this, then let's keep at that. Even if it means lowering it for today because it's just a bad day, that's okay. But let's not just completely be inconsistent with our normal rules. If the rule is you take your plate to the kitchen, you wash it off and you put it in the dishwasher, but this particular day is really bad, you could say, hey, just, you know what? I see you were having a rough day today. So how about you just take the plate and put it in the sink? I'll get it from there today. We'll go back to regular schedules tomorrow, right? Kid will really appreciate that. And it'll keep that problem behavior from happening to where they don't want to even get up from the table and get the plate. Expects don't expect skills the child hasn't learned yet. And again, I use my little boy for an example, the little boy that would just get so upset in math class. Expecting him to do that worksheet was an impossibility that would never happen. He just simply didn't know how. His skill set, even if he had wanted to, his skill set just, he didn't have it to do it. So it's important to not ask the children or ask your child to do something they don't know how to do. It's not fair. Don't respond emotionally, right? And that's so hard to do as a parent. I think again of that time with the sleeping over, and I just wanted to scream and say, and maybe I did, it's been a long time, but maybe I just wanted to say, I've been working all day and I'm tired, and how can you guys just harass me like that over spending the night? But that's not helpful, and it's going to create more damage, more issues in the long run, and it's going to be helpful. So don't respond emotionally. Try to be calm. Try to think of it from the child's perspective, and just understand that they're in their little world and their little sphere. They have no possible comprehension of your level of fatigue. Here's the example. I know I've used several examples through this presentation, but the example I wrote down, a child screams for a toy. The parent eventually gives the toy just to stop the screaming. The child learns screaming works. If I scream long enough, I am going to get this toy. I want the iPad, I want it now. When you're tired and you've had a day, and it's just easier to hand the toy. Consistency and calm responses help reduce challenging behaviors. Sometimes additional support is helpful. One of the toughest things to do is ask for help. Having raised as many kids as I did, it was very hard to reach out to someone and say, you know what, I'm really struggling with this. Can you help me? Can you give me some ideas? It's really hard. I don't know why it is so hard for us. I think it's because we're all cognizant of how busy everyone is and how many things everyone is juggling. So we just feel awkward asking someone for help with our problems. But additional support is helpful. You should reach out when behaviors are frequent, they're severe, and you just don't know how to deal with it. When safety becomes an issue, the boy with the head, right? He was banging his head into walls, and sometimes he would hit a stud and he would just rip his forehead open. And it was really, really serious. And it was so outside of the parents' skill set to be able to deal with what was happening with that child. Behaviors interfere with learning or daily routines. You can't get your kid to get on the bus. Every morning is a disaster. Every morning is screaming and crying and just trying to get your kid on the school bus. This is interfering with these routines, right? This is interfering with this child's ability to go to school and be able to learn. And whatever strategies you're using are just not working. These are really good reasons to reach out and ask for help. Support may include some sort of behavior therapy, ABA, parent coaching, school collaboration, or a behavior plan, a very specific behavior plan that's developed by a BCBA. They can tell you specifically, hey, because we can test, right? We can test and know exactly what the function for the behavior is. We also spend time with you as a parent to figure out the reinforcers that work for your child. We look at your child's overall development and where they are, and we're able to devise a plan that's very specific to your kiddo to deal with those behaviors, and then we can spend time with you to help you incorporate that at home. You should remember that you're not alone. Support and guidance can make a big difference. There's no shame in asking for help. And most of the professionals, if not all professionals in this field, are in this field because they truly want to help you. They want to help your child. The commitment to you and your child is what drove most of us into this field. So, in summary, let's remember always that behavior serves a function. Prevention is a powerful tool. If you can manipulate those antecedents, if you can manipulate the events that usually happen before a behavior, it is powerful to be able to do that, especially as you're teaching alternate behaviors that are not problematic, right? So working on asking for help, working on asking for a break, you were working on all these appropriate things, and while we're doing that, we're going to manipulate as best we can the situation so that the behavior doesn't happen. Teach replacement skills. Again, the thing to remember about replacement skills, it has to be easier to do, and it has to lead to the same consequence. If I bang my head on the table gets me a break from my homework because my parent is now worried about that I hurt my head. Am I okay? So now I'm getting like this huge break, but it was worth it to me because I really didn't want to deal with the homework. Teaching me to say I need a break should immediately lead to me being able to walk away from the homework just as quick as I did when I banged my head. So again, alternate behavior has to be easier and produce the same effect. Reinforce positive behaviors. You can never over reinforce. I think some parents sometimes are afraid, right? They're afraid of, well, I tell him he asked for a break. Well, every time it gets to his head, maybe it's too much. It's not. You're reinforcing a very specific behavior. You're not saying you're just a great kid all the time, or you're the smartest kid on the planet. You're not saying that. You're saying, hey, the way you asked me for a break just then was fabulous, and I really loved it. Small, consistent changes. Again, this has been the theme throughout our parent training. Baby steps, right? Small, consistent changes can lead to big improvements. One of the greatest joys about being a BCBA is I get to do reassessments. And if your child is involved in ABA, you probably have to sign a few reassessments. So in reassessments, we look at all of the data that's been gathered over that particular reporting period, right? It could be 3 months, it could be 6 months, depends on your insurance company. So I look at these graphs, and there is nothing more awesome for a BCBA than to look at those graphs and see just a continuous trend of baby steps moving towards where we want to be at that 100% mark. And that's when you're doing, the kiddo's getting there. Whatever we're helping that child learn a skill, acquisition skill, a replacement skill to the behaviors, whatever it may be, we're helping them get to where they need to be. Small, consistent changes. You're not going to change overnight, right? Your kid is going to test you. He's going to test you for consistency. He's going to test those old behavior patterns, but you're going to get there little by little by little by just being consistent. What are we going to talk about next month? Month 7, we're going to talk about generalization and maintenance. This is important, right? Because if a child has figured out how to do certain things in the clinic, that's all well and good, but it's no good if they don't generalize those gains in all the other environments that they function in, mainly home, community, and school. So we're going to talk about why does this topic matter for your child's learning? Why does generalization and maintenance matter? Strategies to apply at home to make sure gains made in the clinic or gains made in school are kept at home and in the community. Simple practice activity for the month or the week, and encouragement and motivation to keep going. Parents are a very important part of what we do, and without them, we wouldn't be able to help the children. It's not just one-sided. So it's been awesome talking to you guys today. I hope that you learned something from this presentation, and I hope you have a great night.